So chronic hypertension is something that is about blood pressure, which we're going to start talking about later. It's a degenerative process that begins in youth. So hypertension is high blood pressure, and that can happen because your blood vessels don't have as much elasticity, and they're not stretching enough. So then the pressure inside of them is higher. It's called the silent disease because a lot of times you have no symptoms until it's gone on for a long time. High blood pressure can cause little tears in your blood vessels, and those little tears are then more vulnerable to developing cholesterol buildup on them and getting obstructions in them, which can lead to heart attacks and strokes. If you get permanently hardened arteries from too much cholesterol building up in them, then it's called arteriosclerosis. So there's subtle differences, but basically you don't want to have high blood pressure. When women go through menopause, they're higher at risk for hypertension. The estrogen actually reduces your chances of having hypertension. And so after you stop making estrogen, then you're more likely to have high blood pressure conditions. High blood pressure is definitely associated with stress and inflammation, which we've been learning isn't a good thing for so many reasons. So your radial artery right here or your carotid artery over here, but there's sometimes people feel their pulse in other places. You usually feel your pulse in an area where you have kind of a narrow part of your body, so your arteries can't really be that deep, so they're a little closer to the surface, and that's why you can find them in those areas. They're called pressure points, where you can easily palpate and feel the stretching and the recoil of your arteries as the ventricles squeeze and go through systole. That's when the blood vessel pulls out, stretches out. And then while the ventricles are relaxing during ventricular diastole, that's when they recoil. So when you take your blood pressure or you get your blood pressure recorded, you're usually getting two numbers. You're getting the systolic number, which is the higher number, and the diastolic number, which is the lower number. So you'll say like, oh, my blood pressure was 110/70. So you have two numbers, a high one and a low one. If we had been in class, we would have done a little blood pressure lab and learned how to use a blood pressure cuff to take your blood pressure. You put a cuff around you, and you can use a stethoscope where you put the little thing in your ears and a little round disc. You put the stethoscope right underneath the cuff right here on top of your radial artery. And then you pump up the cuff so you cut off all the blood flow that's coming through your arm. As you slowly let go, let the pressure go down. When blood starts to squirt through here, it squirts through turbulently and it makes a little tap, tap, tap noise. And then that's the highest number. We call it systolic number. When you first hear that, sometimes if you're watching the dial, you can see it start to twitch. And then as you continue to slowly let the blood pressure off the cuff, pretty soon the blood will be flowing through without being impeded by the cuff, and it'll flow through smoothly, and you won't hear any more little tap, tap, tap. That is the lower number called the diastolic number. Those little sounds that you hear are called the sounds of Korsakoff. I don't know, maybe he's the one who named them. So if your numbers turn out to be lower than 110 for your systolic number, sometimes you have such low blood pressure that when you are laying down and you stand up, you don't have enough pressure to get blood all the way up to your head, and you feel lightheaded, you get really dizzy because you're not getting enough oxygen to your brain. So sometimes that happens to anyone, but people who have low blood pressure, that would happen more frequently. Usually it's not dangerous to have low blood pressure unless you pass out and fall and hit your head on something. Hypertension, on the other hand, high blood pressure is a big dangerous concern. And that's when your systolic number is over 140. And if it's chronic, it can cause damage to delicate little organs like your pancreas. Oh, here's some little blood vessels with some plaque building up in them, a narrower diameter and less flexibility to expand and contract for vasoconstriction, and vasodilation leads to high blood pressure. Organs like your pancreas and your kidneys are really delicate organs that can be severely damaged from high blood pressure. And they're not organs that heal themselves once they get damaged. So then you have to either get a replacement or die. This is showing a nice diagram of how the pressure in your whole circulatory system changes and how blood is always flowing from an area of high pressure to an area of lower pressure. So when your blood first comes out of your aorta, it's got really extreme highs and lows. By the time it gets to your arm where you're getting your blood pressure taken, it's not as high as it was when it first squirted out of your ventricles. So you're getting a number like around 110 over 85 would have been this person's blood pressure. It continues to pulse through all your arteries, but eventually there's not enough elastic recoil for it to continue pulsing. When it gets into smaller and smaller arterioles, it's just flowing. When it goes through the capillary bed, it's still continuing to flow from an area of higher pressure to low pressure, but the velocity of blood slows down tremendously while it's in your capillary bed. And then it actually increases a little bit as it's coming through your venules. Super low pressure in your venules is why they don't bleed that much when you cut into them, and why you can get like a needle put into your vein and blood doesn't squirt all over the place. But it's still going a little faster because the total surface area of your veins is smaller than the total surface area of the capillary bed. So it'd be like you and your little raft. You were on the lake, and now you come to the end where a river is leaving, your raft would start to move a little faster again. So some of the factors that are affecting blood pressure are discussed on page 195 of your packet. So blood pressure is related to cardiac output, which we just learned about. Cardiac output, remember, was heart rate times stroke volume. The amount of blood coming out, cardiac output per minute, times the peripheral resistance is what affects your blood pressure. So peripheral resistance is, if you were in your little raft, how much you bump against the edges or the sides of the river. So every time you bump against the side of the river, it's going to cause pressure. So the smaller the vessel is, the higher the blood pressure will be. But if it's more dilated, the lower the blood pressure would be. So you can monitor blood pressure with vasoconstriction and vasodilation. Your blood pressure can, like homeostatic mechanisms could slow your heart rate down to try to decrease your blood pressure, but you still have to have cardiac output to deliver oxygen and food to all your cells. So it's tricky how your body maintains homeostasis of all these factors interacting. On page 195, let's just go through these different scenarios and look at what would happen to blood pressure. Would it be increasing or decreasing? An increased diameter of the arterioles increases peripheral resistance. So it would be the opposite of this one. It's vasodilation. In vasodilation would cause a decrease in peripheral resistance, and that would make a decrease in pressure. Increased blood viscosity, that's like how thick or runny your blood is. Increased blood viscosity increases the peripheral resistance. So blood viscosity is if your blood is thicker, is usually because you have a higher concentration of blood cells in it or more albumin. Sometimes people who go to high altitudes get more blood cells, and then their blood will be more viscous. That would increase their blood viscosity and increase peripheral resistance and increase arterial pressure. Increasing cardiac output, you can tell by this equation, it's definitely going to have an increase in blood pressure. Increase in heart rate will cause an increase in cardiac output, which will cause an increase in arterial pressure. Anxiety and fear are things that, like also stress, things that stimulate your sympathetic nervous system. All of those things will increase your heart rate and increase your stroke volume, increase cardiac output, and increase your blood pressure. Increased urine output would reduce your total blood volume, and that would decrease arterial blood pressure. Sudden change in position from reclining to standing. So when you're reclining, your blood can easily travel everywhere in your body because you're kind of level. But as you stand up, a lot of blood falls down into your legs. So usually your blood pressure that you take in your arms, and sometimes you even feel it in your head, goes down. Physical exercise activates your centers in your brain, which increases your heart rate and causes vasoconstriction and increases blood pressure. Physical training will increase the efficiency of your heart and decrease peripheral resistance. As you become physically trained, you probably are getting leaner and you have less length of your blood vessels because you don't have so many miles of real estate of you. The length of a vessel is also a factor that can increase peripheral resistance. And alcohol decreases your blood viscosity, so that would decrease blood pressure. So sometimes people who are drinking a lot of alcohol get lightheaded more easily when they're standing up. Hemorrhage is decreasing your total blood volume, would decrease stroke volume, and that would decrease your blood pressure. Drugs like nicotine and renin is one that causes you to conserve water in your kidneys. Those will cause vasoconstriction and increase your blood pressure. And arteriosclerosis is when your blood vessels are less flexible. That increases peripheral resistance and would increase blood pressure. So what is peripheral resistance? Let me move this down here. Peripheral, this is a nice little video that describes peripheral resistance. This shows vasoconstriction. And you can see the more blood vessels are hitting the edge of the vessel when it's constricted. So that increases blood pressure. Thank you. So you turn to page 196 of your packet. There is a section of just true or false. And if they are false, which most of them are, you have to change the underlined word to fix it. So renin is a hormone released by the kidneys when blood pressure is low that causes an increase in blood pressure. The decreasing efficiency of the sympathetic nervous system vasoconstrictor functioning due to aging leads to a type of hypotension called orthostatic hypotension, which is what I was just describing. When you stand up and you get dizzy, that happens more when you're old and your sympathetic and parasympathetic nervous system don't work so well. Places that you usually don't have vasoconstriction are your vital organs, your heart and your brain. A stethoscope is the little tool that your doctor puts in their ears, and it has a little round thing that they can put on your body and listen to things. Pulmonary circulation is a low pressure circulation. The fetal equivalent of functional lungs and liver is the placenta. Cold has a vasoconstricting effect, and chronic hypertension is called the silent killer. So I'm sorry we didn't get to do all the labs of exercising and laying down and standing up and taking blood pressure. It's usually a really fun part of the class. And that was kind of the last thing we're doing this year, except for just a little bit of reflecting. So I hope I get to see you. I hope you're staying well. Namaste.